Hello, everyone. Welcome back to our plenary session. Thank you for joining CCH's 2020 ATI, Housing Equals Justice. You are now in the plenary session, the lunchtime plenary session, which is called Crisis in the Rental Market. And in a moment, I'll introduce Commissioner Mosquera-Bruno, who will introduce this panel. I hope you all are enjoying the conference thus far. As we've noted, this is our first time doing this virtually. So typically when we'd have this lunchtime plenary, we'd all be serving lunch and you'd be hearing the clinking and clanking of silverware, but we're doing this a little bit differently this year, but really glad that you are all joining us today. We go to the next slide. So again, this year's conference and annual training institute, this is our 18th year holding this event, and it's themed around the idea of housing equals justice, focusing on homelessness as a racial justice, economic justice, and a criminal justice issue. And this year, we're really thinking about how to lift up the level of thinking with regard to how do we tackle homelessness as a housing justice issue. Next slide. We are hoping that you can follow us on social media. We have a number of hashtags. We're on Facebook, Twitter, and Instagram. Please continue to share what you're hearing through these conference sessions through social media. You can use hashtag ATI 2020, hashtag housing equals justice, or hashtag end homelessness, and share what you're hearing throughout these sessions that we've been holding. We're now in day 2. We've had several sessions already, and I know there's been a great deal of attendance, so please continue to follow and share what you're learning through social media. Want to thank our presenting sponsors for the entire event, Bank of America and Zillow. In a moment, you'll also hear from Zillow speaking. And I also want to thank the Connecticut Department of Housing for being the sponsor for this particular plenary session. I wanted to introduce Commissioner Celia Mosquera-Bruno of the Department of Housing, who is not only sponsoring the event, but is also introducing this. For those of you who are joining us from Connecticut, she likely needs no introduction. Commissioner Mosquera-Bruno leads our Connecticut Department of Housing, which she's been doing since early 2019 when she was appointed by Governor Ned Lamont to lead this agency. Prior to joining the Department of Housing, she served as the President and Chief Executive Officer for NeighborWorks New Horizons, otherwise known as Mutual Housing Association of South Central Connecticut, where she had been for over 20 years and has a wealth of experience in housing development, housing property management, and many other issues. I wanted to just note, yesterday during my opening remarks, I talked about a quote from Audre Lorde, where she said that sometimes we're blessed with being able to choose the time and the arena and the manner of our revolution, but more usually we must do battle where we are standing. And I think that couldn't be more true for Commissioner Mosquera-Bruno, who when she joined as the Commissioner of the Department of Housing, probably had no idea that she'd be tackling a COVID-19 pandemic on top of all the other housing issues that we're dealing, not to mention unprecedented new challenges in the housing market. And I have to say, as someone who's worked closely with her over the last year and a half, Commissioner Mosquera-Bruno has really tackled the whole range of housing issues, and there's so much really riding on her shoulders. And so, these are the kind of challenges that nobody asks for, but that it's really about how we step up in the face of those challenges. So I really want to thank Commissioner Mosquera-Bruno for her leadership, for her partnership, and for her commitment to not only ending homelessness, but addressing the broad array of housing challenges that our state is now facing. So with that, Commissioner Mosquera-Bruno, please introduce the session. Thank you so much for everything you're doing.
Thank you, Richard. Thank you for the great introduction. Good afternoon to all of you. Trying to you guys have been, this is your second day on this training, in annual training. As Richard mentioned before, in the past, you have food in front of you. Today you don't, you have me. My name is Celia Mosquera-Bruno, the Commissioner of Housing. It has been an absolutely devastating year for our state and our country as we enter the 7 months of the pandemic. I pray that you and your families continue to stay safe and protected during these trying times. Since the very beginning of the pandemic, the Department of Housing sprang into action to help our municipalities and to keep the virus from spreading. Through our individual and family support program unit, we took the following steps: decompressing the shelters, reducing capacity by 60%. To achieve that, we contracted for 825 hotel rooms throughout the state. As a result, very few homeless individuals contracted COVID. Collaborated with the Coordinated Access Network to house over 1,000 households between June 1st and September 30th. Allocated $1 million of state funds for homeless diversion in the early days of COVID to prevent households from entering homelessness. We have added another $1.2 million of ESG resources for the coming year. Allocated over $8 million in ESG for rapid rehousing. Allocated $5.3 million for the creation of a homeless eviction prevention program. Provided $5 million in funding for the CANs to support the hotels, shelters, for overtime, hazard pay, the provision of PPE, and planning to keep capacity of cold weather beds at the same pre-pandemic level. Created a $1 million RFP for traditional homeless outreach services to address unsheltered homelessness. Waived our policy of waiting 30 days to implement an income change for the rental assistance program and federal Section 8 vouchers, allowing for immediate verification. Thank you to my staff, specifically Steve, Cara Lee, Bo, for the tireless efforts. Also, thank you to the entire CAN system, from the executive directors to the frontline staff, for your work and perseverance through all of this. In other areas, the department, in collaboration with the Connecticut Housing Finance Authority, created 2 programs to assist individuals and families who were financially impacted by COVID with their rents or mortgages. $40 million has been allocated to the temporary rental assistance program and $10 million to the temporary mortgage assistance program. On the production side, of course, we can't forget that we need to keep building. Residential construction has now stopped, and we have been able to continue creating and preserving homes that are affordable. During the current calendar year, 518 units across 9 developments have been completed. There are currently 91 projects actively under construction across the state. That represents the creation of more than 4,200 housing units. More than half of these are anticipated to be completed during the calendar year. The state investment of $175 million leveraged $913 million in other public and private funding. Governor Lamont and his administration have been proactive in its response to the public health crisis and has supported the department's initiatives to assist our residents. We still have a lot of work ahead of us. Collectively, we should increase our advocacy at the federal level for more housing resources for our low-income and vulnerable populations. I look forward to continuing our collaboration. We are most successful when we all work together. Now, I'm gonna have the honor to introduce 3 amazing women. The bios of our distinguished presenters are on the website. It is my pleasure to introduce our keynote speaker, Dr. Young. She's not just an economist. She is actively involved in affordable housing. She is a board member of a Tenderloin Neighborhood Development Corporation in San Francisco. Dr. Cheryl Young, senior economist at Zillow, will present Zillow's research linking rising rents and homelessness, discuss the state of the rental market in Connecticut, and will share steps that Connecticut can take to address this situation. Dr. Young?
Thank you so much for that kind introduction, Commissioner. Let me just pull this up here. So thank you everyone for having me. Very excited to participate in this panel. And so let me just kick this off by talking about what's going on in the housing market. And I think what I'm gonna do is kind of kick it off with a discussion about what we're seeing nationally and actually for the for sale market. We're seeing a lot of headlines about the housing market right now. And I think sort of the overwhelming headline that a lot of people hear about is that the housing market is sort of the bright spot in the economy, and it's not really reflecting a lot of the economic conditions that we're seeing, a lot of the economic instability and unemployment numbers. And I'll talk a little bit about why this is and what happens when we start taking apart some of the layers of the housing market to really uncover where the inequalities are, who's disproportionately affected. So on the for sale market side, I think everyone sort of heard prices are going up. If you're a seller, it's a great time. And I think these two graphs can talk you through exactly what's going on. Those blue lines, that's 2019. That actually represents a more typical year, especially if you look at the shape of the arc of these two graphs. So on the left-hand side, you have median list price. Typically what we see is that list price goes up as you enter sort of spring home buying season. It peaks around the summer, and then it kind of goes down in fall and winter when home buying is not so hot. But as many of you remember, this was the exact same time the home buying season coincided with widespread infections of COVID-19, shelter-in-place ordinances, and the housing market, much like the rest of the economy, pushed pause. And so what we see here is a really interesting fact. We see a real sort of divergence in terms of prices. So as the economy started to open up and open houses were a thing again, prices went way up. And we're not sure if it's sort of shifted the home buying season over or if it's extended it. But one thing is for certain is that prices are way higher than they were last year. And why is that? Well, really, if you look at the graph on the right, there's not a lot of supply out there. For sale inventory, again, this numbers from this year, a real divergence. We actually saw inventory completely plummet as we entered summer. And what's going on is that there is a lot of demand for housing. There was demand as we entered spring home buying season. People kind of had to delay their plans. Mortgage rates are super low. A lot of people actually want to buy homes now because we're spending so much time in places where we live, as offices, as extended classrooms. And so the demand is there, but there aren't a lot of sellers back on the market now. And I think there are two sort of reasons for that. The first is that sellers, a lot of them are also buyers. So if you're selling your house and you're buying that next house, which is typically something you're trading up to, that next house is further and further out of reach, as you see in terms of prices. So with the economy the way it is it a really good idea for you? You may be able to get a good deal on your house if you sell it, to go on the market and look for something that's more expensive and to make that decision right now. Maybe not. If you can hang out in your house a little longer, you may do that. The second reason we're seeing inventory so low is that a lot of people who end up selling are people that are sort of downsizing. So that group of people are people who have aged into retirement. And we know that there's a lot of people sort of in the baby boomer generation that are ready to downsize. But given what we know about the virus, is it a good idea for you to move into a retirement community right now or assisted living facility? Probably not. So, I think a lot of people are hearing that the housing market is doing great, but, we really want to start digging into this a little bit more. So on the for sale side too, if you're a homeowner, you're doing pretty well. So if you're a homeowner, your home values are going up. They were kind of slowing down. They're never really sort of going negative, not since the Great Recession, but you're seeing your home values go up. So you're doing quite well. I just want to point out, a lot of people were wondering with the rise in home prices and home values if we were going to hit another bubble. This is something that I think is not the same as what we saw in the Great Recession. This is something that is really driven by low inventory. So I just wanted to address that. And then kind of get into the meat of this discussion, which is the rental market. And the rental market is a much better barometer of what's going on in terms of the economy. So, I think the big story in the rental market is that rents are cooling, and that's not true everywhere. And if we look at some of these Connecticut metros, we do see that rent growth is pretty robust, especially in New Haven and Hartford. In Stamford, it's sort of leveling out. It's going down and cooling off a little bit, but nationally, rents are very cool, and you can see that sharp drop down to just over 0 right now, just under 1% rent growth. So we're not seeing negative rents nationwide. We're seeing it in some markets. Where I sit in San Francisco, rents are down about 4%. So we are seeing rents kind of cool overall. In some markets, they're still going quite strong, but I think people have kind of latched on to the rent cooling narrative as a way to say, you know, things are getting better for renters. But here's another piece of data that we tend to look at when we look at the rental market is that, you know, is demand there? And typically, if there's a lot of demand, you don't really need to help entice people to rent. And so these numbers are really around the share of rentals right now that we're seeing that have a concession. So a concession is something like free rent. So we're free rent, anything from 2 weeks to 2 months. And so we see that, you know, in Hartford metro area, it's almost 28% of all rentals have some kind of concession. Another common concession is something like a discount on a deposit. But nationwide, it's over 30%. So really, we see rental demand slowing. Landlords feel like they need to provide some kind of incentive to get people in without lowering the rent. So this is actually probably masking some of the rental market behavior. We might actually see rents drop more if concessions weren't available. But if landlords are able to provide these, they don't have to take a hit on their rent rolls long term. So this is really common now. And if you look back just to 2018, it was very uncommon to actually have concessions, you know, less than 5%, both in the Hartford area and also nationally. So clearly something is going on in the rental market. You know, why is it that we're seeing rental market softening? And I think there's a sort of a more benign story, which is around young people moving home, and that's certainly true. 18 to 25-year-olds, we have about 2 million more of them living at home with their parents and grandparents than we did a year ago. That's because, you know, a lot of colleges have provided, universities have provided remote learning opportunities. Not all campuses are completely open. We do see people doubling up, especially in the early days of the pandemic, if their leases went up. So those have freed up spaces in the rental market. A lot of other people have moved home in older generations, like millennials who need help with childcare. It's not easy to travel right now, so maybe it is better to stay with your parents or have the family unit pretty close, extended family unit pretty close. But I think the key issue in the rental market right now is the fact that you know, the wave of sort of unemployment that we've seen and that continues and persists in certain industries really had an impact on the rental market, because a lot of the people that were affected by unemployment are renters. And let me walk you through some of these numbers. So what we wanted to see, these are national numbers here, is the share of housing payments owed by newly employed in each industry. So if we think about the pandemic and we think about what happened to local economies, I think the most glaring sort of industries that we think about that were hit hard are, you know, food service workers and hotel workers. So food service, tourism industry is hit really hard as things just sort of shut down, right? Arts, entertainment, and recreation also hit hard, and then retail trade. So people working retail, as you know, stores and everything sort of closed. So if you look at those industries here, that's the second and third bar, and then further down is retail. That's about 50% of all housing payments in the US, both renters and homeowners, owed by these industries. So clearly this is something that is impacting a lot of people, and therefore sort of impacting the housing market. And then if we break that down even further and we look at, you know, those same industries, I just want to highlight those because those are sort of top of mind for me when I think about the pandemic. Accommodation, food services, third one down, and the retail right after that. Further down, around midway down, you see arts, entertainment, and recreation. You see food service and accommodation in particular, that orange bar, that's the share of rental payments. So a lot of renters in that space, retail trade, more than half, and same with arts, entertainment, and recreation. So you see a lot of these rental payments sort of at risk, right? Because of these industries that were hit hard by unemployment. And, you know, just to kind of think about it in a different way, we also see that the Bureau of Labor Statistics actually identified these high contact intensity jobs. They're jobs that, you know, are very difficult to do without social distancing, but, you know, a lot of them were at risk for unemployment, but also at public health risk, right? These are jobs that people might have to still go to, but you know, they are also exposing themselves potentially to the virus because, you know, this is their livelihood. So we looked at sort of the Hartford metro area just to see, you know, what share of sort of the homeowner income actually comes from one of those jobs. And it's not insignificant, right? About 46%. But then if you look at the renter side, a lot more renter households rely on income from those types of jobs, 79% of renter households. So if you think about it, you know, the rental market in general has a lot of exposure to what we've seen in the economy recently, both in terms of unemployment as well as sort of this public health risk. And I think that's what we really want to focus on in this discussion. And I think one cut we were actually really interested in looking at too is, you know, how is this affecting other sort of communities and within sort of these different job classes? Well, if we look at the people that are most affected and we cut it by, say, race or ethnicity, you know, this is like, again, homeowners and renters, you know, Hispanic and Black households are disproportionately affected because they rely more on those types of jobs for household income than white households. And we already know about the pandemic, right, is that these communities are also disproportionately affected when it comes to the virus, both because of, you know, sort of public health issues and health coverage issues, but also, you know, the sort of systemic reasons around why people have comorbidities. So this is something that I thought was really interesting. And as we kind of like peel back the layers of the housing market and kind of understand what we're dealing with here, this kind of exposes who's at risk and why we need to kind of understand what is actually going on in the dynamics of the rental market and where rent burdens are falling. So, you know, just to kind of step back and to think about affordability and, you know, the way we measure it is sort of by housing burden is what share of your income it actually goes towards paying a mortgage or paying rent. You know, this is something that we look at. We tend to look at actually two ways to look at it, right? One is the actual rent or actual mortgage you're paying. And that's simply looking at, say, census data and saying, okay, this person said, or this household said they spent this much money on a mortgage or this much money on rent, and this is their income. So this is the share of their income. And then we look at what might happen if that same household or person went to the market right now and decided to take out a mortgage or to rent a unit. And interestingly, if you, despite what I was telling you about home prices rising, if you are a homeowner and you go out there and you take out a mortgage with your same income, you might actually pay a little bit less of your income just because of what's going on with mortgage rates. You know, the mortgage rates going down has actually had a really strong impact on so-called affordability, despite, like I said, these home prices going up. But on the rental side, it's a really different story, right? So, you know, obviously we tend to look at 30% is considered rent burden. Right now, sort of in the Bridgeport area, we have about 28% of your income is going to be spent on rent if you're a renter right now. But if you hit the rental market, despite this cooling that we were talking about, you know, rent burdens actually go up considerably. So if you're the typical renter and you hit the market and you try to find something, you're going to be spending over 55% of your income on rent, so severely rent burdened. And this is something that I think is really interesting. When we go to Hartford, we see a similar story. It's not as extreme, but you know, again, if you're a renter and you hit the rental market, over 41%, 42% of your income is going to go to rent. New Haven, a very kind of a similar story. So you know, I think just to sort of start situating this conversation about rent burdens and how much we're thinking about rental markets, you know, I think the cooling of the rental market is a really easy headline for a lot of people. But when we think about this intersection of unemployment, of underemployment, and of you know, public health risks with COVID-19, rent burdens is the conversation we're having. So, you know, if your income shrinks and rents are cooling, you're still going to have a really hard time meeting those rental obligations. So, you know, at Zillow, we actually worked with some researchers, and we have one of them has just joined our team from the University of New Hampshire. But what we wanted to do was to see, is there actually a connection between rising rent affordability, so that rent burden, that share of income towards rent, and rising homelessness rates. A couple of years ago, we did some research on this using a sort of complicated statistical model that even I don't really understand. But what we wanted to see was, is there sort of a tipping point, an inflection point at which your typical rent burden would sort of signal a potential rise in homelessness rates. So there were sort of two inflection points. The steeper one is when you start to see people spending at least 32% of their income on rents. That's when you actually see a connection to rising homelessness rates. So we looked at a number of COCs across the country, grouped them together based on a number of factors, and saw that this particular inflection point was much more indicative of homelessness rates rising than anything else. So that's also something to keep in mind. So when we think about, and the reason why I talked about the housing market so much in the run up to this conversation around homelessness, is that when we think about homelessness policy, it's really starting with housing policy. And right now it's about, you know, rental policy and how we can actually keep people in their homes, given what we're seeing in terms of the economy and in terms of, you know, COVID-19 infections. So let me just actually, I think this is a really great slide to kind of tell you where we're at and how we're starting to think about things. You know, the CARES Act, the federal government stepped up in a big way with the CARES Act in terms of that expansion of unemployment insurance. And that extra $600 a week really allowed people to meet their rental obligations. The National Multifamily Housing Council has said the same when using their rent payment tracker. A lot of people were actually able to pay rent during that time. And of course, this expanded benefit expired in September, end of September. And so what happened in terms of rent burdens? Well, if you look at sort of nationally, we also pulled out some data from Hartford metro area. If you look at severely rent burdened households with that expanded unemployment insurance, you know, about 3.2% are nationally, and then 1.6% in Hartford had severe burden, so paying more than 50% of their income on rent. So small numbers, I mean, still concerning, but small. But once we took away that expanded an insurance benefit, suddenly you have a whole lot of people facing severe rent burden, right? So nationally, it's over 41%. In Hartford, it's almost 38%. So, you know, the idea of cash assistance as helping people, well, it actually worked, right? You know, and I think when we think about these policies moving forward, the idea of rental assistance or cash assistance has been really effective if you look at these this graph in particular. And then when we think about other tools in our kind of toolkit, you know, vouchers are obviously something that have were existing before, you know, this pandemic, and this idea of rental assistance is one that I think, you know, clearly has been working. But when we think about not just rent burden, but rent growth, like we were talking about before, this can actually help us kind of see how sharp our tools are in our toolkit, right? So in New Haven, for example, we compare growth of fair market rents versus actual rent growth, comparing that two-bedroom fair market rent, and then the growth in the actual rental market and the share of listings that are actually affordable. And in New Haven, you know, it's actually quite strong, fair market rent growth. The vouchers are pretty effective, but there just isn't a lot out there. There's about 48% of all two-bedroom units are affordable. I'm almost done here. And then I just want to say, you know, if we look at, you know, so Fairfield County, fair market rents are pretty much keeping pace too. You start to see less units that are available under fair market rents, 22.7%. And then I think this is the story that I wanted to tell, which is in Harford County, you know, suddenly we're seeing fair market rents aren't keeping pace with rental price growth. And this is a problem that we're seeing, is that, you know, as we think about increasing rent burdens, as we think about rent price growth compared to some of the other benchmarks that we have, you know, our tools and our toolkit are being blunted by that. So, you know, as we think about the next months and possibly years, as the economy kind of struggles to come back, how can we address these issues in the rental market to make sure that people can stay in place? Kick it back over to the commissioner.
Thank you very much, Dr. Young. This is such an insightful presentation. Now I'm going to invite Dr. Jill Khadduri. You have been in this space for many years. You have done extensive research on housing policy, co-author of a book. What are your thoughts about Dr. Young's findings?
Thank you very much, Commissioner. I'm just trying to get my slideshow to begin here. Slideshow. Slideshow. Well, okay, I'll do it this way. So, thank you so much, Commissioner, and thank you so much, Richard, for inviting me to be part of this panel. I'm going to show more evidence on the relationship between unaffordable rents and homelessness, and I'm going to tell you about the solutions. I'm going to be drawing on information from a book by Vanderbilt professor Beth Shin and me. The book was published earlier this year, and it's a comprehensive treatment of the nature of homelessness, its causes, and evidence-based solutions. Dr. Young's analysis confirms other evidence on the relationship between rent levels and homelessness. The left axis on this graph shows the share of the population that is homeless based on point-in-time counts. The bottom axis shows the median rent. And as you can see, homelessness is especially common in more expensive rental markets, notably the metro areas that are in the oval. Those areas don't just have high rents, they also have great income inequality and a lot of people living in poverty. This map shows the same relationship. Some of you will be familiar with it, many of you probably. It's published every year by the National Low Income Housing Coalition. And for each state, it shows the full-time wage that would be needed to afford the fair market rent. The darker blue the higher the wage that's needed. So the darker colored states are the same states that have high levels of homelessness, as shown by the annual homeless assessment reports. This slide shows how we got into the housing affordability crisis, which is not just a current crisis, it's been building for a long time. The left axis is millions of units affordable to the 25% of renters with the lowest incomes. In 1970, there was a surplus of 500,000 rental units affordable to people in the lowest quartile. By 1975, there was a deficit of 1 million units, and it kept getting worse. During that same time, the current epidemic of homelessness appeared. Now, how did the gap between rents and incomes happen? Well, following World War II, the lowest cost housing stock disappeared. Millions of housing units that did not have indoor plumbing or were dilapidated were replaced by good quality housing. At the same time, single room occupancy hotels that were common in many US cities were demolished or turned into other uses. So by the later decades of the 20th century, the lowest cost units were no longer there. But incomes didn't do the same thing. Poverty persisted and increasingly became deep poverty as income inequality got worse in the United States. The housing stock that we have now and will have after COVID simply cannot be maintained at rents that the poorest renters can afford to pay. So the clear solution, as mentioned by Cheryl Young, is housing vouchers. There's growing political support for what's being called a universal voucher program, meaning it would be available to all renters eligible by virtue of their income. That's great, and I hope it happens. But it's not necessary to choose between making vouchers an entitlement program like food stamps and leaving the current situation in which vouchers expand by only a trivial number of units each year if they expand at all. In our book, Beth Shin and I propose going back to a time in the late 1970s when Congress appropriated funds for an additional 300,000 assisted housing units each year. Even if vouchers were made an open enrollment program, that's about the pace at which vouchers could increase, because there'd have to be a phase-in as housing authorities staffed up to handle the administration of the program. A common worry A common worry is that a major expansion of housing vouchers would drive up rents. That simply isn't the case. The best, most recent analysis by Economist shows no inflationary effect from higher numbers of vouchers. Erickson and Ross used a panel from the American Housing Survey to study this issue, and they concluded that there was essentially no difference in the rent increases between metro areas that got more vouchers and metro areas that did not. And even if vouchers were made universal, as I've just said, it wouldn't happen all at once and create a sudden shock to the rental housing market. We could make a universal program smaller by dropping the income limit to 25% of area median income from the current income level for eligibility for housing assistance, which is 30% of area median income. This would be appealing from the point of view of targeting to those most at risk of homelessness, but political support for doing that might be weak and might weaken the appeal of an expanded program. Another approach, one that I think has more appeal, is to target a universal or expanded program to groups most vulnerable to experiencing homelessness. Families with children under the age of 5, and people who are not elderly but who have disabilities that limit their ability to work. A popular conception of homelessness is that it's all about the guy on the left, but the age at which an American is most likely to experience homelessness is in fact infancy. One thing that we could do to prevent family homelessness is to make vouchers universally available to families while their youngest child is under the age of 5. Families are at particularly high risk of experiencing homelessness before their youngest child reaches school age, and in effect, child care is provided by the public education system. Of course, greater availability of subsidized care for younger children would help. However, the way that the US economy works, low-income parents have unpredictable schedules, long commutes, and that makes them vulnerable to losing whatever childcare they have. Now, an objection to tying voucher eligibility to the age of the younger child might be that it would encourage people to have children they can't afford. My response to that is that it's hard for anyone to afford children. And is it just for only the affluent to be able to have children? Furthermore, if restrictions are going to be placed on women's reproductive rights, let's have a public policy response that keeps additional children from experiencing deep poverty and homelessness. People with disabilities are another group particularly vulnerable to experiencing homelessness. They may have limited ability to work, they face job discrimination, they face housing discrimination. There's ample evidence of both of those. We could have a universal voucher program for people under the age of 62 who have disabilities, or we could have a major expansion of the allocations of housing choice vouchers for non-elderly people with disabilities, known as NED. NED is one of the few expansions of vouchers funded in the past 2 decades, but with completely inadequate numbers of units. NED doesn't require a Social Security disability determination, but HUD standards do require documentation of a disability that limits ability to work. And we have evidence that NED is well targeted to the most vulnerable people. A recent study by my company, Apt Associates, matched a sample of NED recipients to Medicaid data, and we found high rates of mental health diagnoses, musculoskeletal problems, and chronic health conditions. Some metro areas need to expand housing supply. Universal housing vouchers would be needed to be supported in some places by efforts to increase the supply of rental housing. The housing affordability crisis is a national problem. Housing supply constraints are a local problem. And a challenge with national programs that build affordable rental housing has been that they are not targeted to the places with the greatest need. In particular, the low-income housing tax credit, as currently designed, has a per capita allocation formula rather than a needs-based formula. I like the idea of an add-on to light tech that would have a matching requirement from state and local appropriations or other own source funds. Places with less need and also less homelessness would not be willing to make such a match. Places with more need and more homelessness would. And even more important than programs that produce affordable housing is to ease zoning requirements that discourage expansion of the housing stock. In particular, states and localities need to reform zoning and other regulations that keep multifamily housing out of neighborhoods and entire jurisdictions. States and localities also need to get rid of zoning and other regulations that prohibit splitting single-family housing units into apartments. You can find more detail about all of this in the book Beth Shin and I just published. So yes, homelessness is a housing problem brought about by a gap between incomes and rents. That gap will persist after the COVID pandemic ends. There may be some cooling of rental markets, as shown by Cheryl Young, but rents are never going to drop to the point where people living in poverty can afford them. And poverty is going to get worse as a result of the pandemic, especially for communities of color. We know what to do about the crisis in housing affordability that leads to homelessness. First and foremost, an expansion of the Housing Choice Voucher Program. And we can afford it. Back in 2013, the Bipartisan Housing Commission proposed a universal housing voucher program that would have cost $31 billion. At the time, that sounded like a lot of money, but even then, it was less than 1% of the federal budget. Thank you very much, Commissioner, and I look forward to hearing the next speaker.
Thank you, Jill. This was excellent points, and you're right. Responding to take care of somebody that is homeless and an adult is too late. We need to start when they're kids, when we have children that we need to protect them from being homelessness. So I'm really gonna look forward to get your book and to read it, and maybe you can sign it for me. So next, I'm glad to ask Ann Oliva. She's gonna bring us all back home. From the Center for Budget and Policy and Priorities will enlighten us on current opportunities and challenges in the federal policy. Olivia?
Hi, everybody. It's good to be with you. I want to thank Richard and the team at the Connecticut Coalition for having me again. I got to be with you in person last year, which was better than being on video, but being on video is pretty good too. And I want to spend a couple of minutes, as the commissioner said, bringing us back home. Let's see, here we go. And, you know, I think that we've heard the data, right? We know what is important as we move forward, and we know that what the solutions are. Jill talked about them, Cheryl talked about them, but we also need to think about what we can do right now about the challenges that we have in front of us. And I'm going to spend a little bit of time talking about that today. I want to start by just highlighting some work that we've been doing nationally. It's the project that we've been working on is called the Framework for an Equitable COVID-19 Homelessness Response. Hopefully, many of you out in the audience have seen this work, and it's really an unprecedented partnership because we think that these are unprecedented times that we're living in. And you can see the number of partners that are working on this project with me at the bottom of your screen. But I just want to note that this partnership in particular has been incredibly helpful to think through. We all bring different ideas to the table and expertise to the table. And this sort of complementary set of ideas and expertise has created something that I think is really interesting. And I'm going to talk a little bit about just a couple of aspects about it today. Whenever we start work, especially if I'm leading this work, we start with setting some values or some principles that will guide what we do, and that are really based on our own experiences and how we want to move forward in the world. So the first thing I want to note here is these are our 5 core principles that are guiding this national work on COVID response for people experiencing homelessness. And the first one is one of the places that I'm going to talk about today, and that's advancing racial justice and equity. The second one is also incredibly important, and I want to be really, really clear about what the word strategic means. Strategic means serving people who are highest need first. So people who are unsheltered, older, disabled, who are medically fragile, are very close to homelessness. Those folks need to be helped first. And we think that that's a strategic use of funds. We want to make sure that we're growing as many partnerships, just like we are at the national level, that we're growing those partnerships at the local level so that we have a broad range of folks, both local organizations and mainstream systems that are going to be bringing their resources to the table. We want to get people into housing, full stop. And we want to act as quickly as we can because we know that business as usual isn't going to work for us in this environment that we're in. We also, I guess the 2 things that I want to pull out from this slide are really that we want to focus on 2 policy areas today in my presentation to sort of bring us home from the data and the ideas that you heard from Cheryl and Jill. So the first is using that racial justice and equity approach and what that means and why we should do it. And the second is really hearing from people who are in those highly impacted and historically marginalized communities, and just to understand what they think we should be doing. And hopefully by the end, you'll have a few tools to use to address these kinds of issues. So the first thing, I think Dr. Young sort of touched on this a little bit, but I want to bring it into sharper focus. We understand that both COVID-19 and homelessness disproportionately impact communities of color. And that is specifically Black, Latino, and Indigenous communities in this country. So we want to make sure that what we are doing in this work is addressing those disparities as we see them. And you can see at the bottom of the screen, this is data that most of you know. 40% of those experiencing homelessness are Black, although they make up only 13% of the US population. And for Latinx people, 22% of the homeless population, but only 18% of the general US population. So these are sort of foundational sets of data that we want to make sure that we're keeping it in our mind as we are developing solutions, both from a broader housing perspective, as has been presented. What are we seeing in the housing market? How are these communities impacted by that housing market? And how is that sort of impacting homeless systems and the people that we're serving every day? But in order to really understand that, here's one of my values, something that I have seen. Many of you know that I was at the Department of Housing and Urban Development for a number of years. And since I left there in 2017, I've gotten to work in community. And what I have learned over the last 3.5 years is that in order to really understand, I'm a data geek, I will admit it, I love digging into it, a spreadsheet is my friend. But all of that said is that tells part of the story. The other part of the story has to come from people who are experiencing the problem that we're trying to solve. And the closer we get to them, the better the outcomes that we'll have as we move forward. So in that spirit, when we started doing this work, we asked the National Innovation Service to actually conduct some listening sessions with people from groups that are historically marginalized within the homeless services system. And you can see the list of folks that we talked to at the top of the screen. And as we reviewed the notes from all 11 of those focus groups, what we saw was 4 themes emerge. And the first one is something that can't be a surprise to any of you who are working in homeless services right now, and that is people want us to reimagine what emergency shelter options and temporary options look like. And I want to be really clear. What folks said in these sessions was that emergency shelters, in a lot of cases, were already bad before COVID-19. COVID-19 put a spotlight on some of the problems within the emergency shelter system. And I think that folks who are in those large congregate style shelters were really struggling and telling us about their struggles within these listening sessions. And that's something that we want to tackle as we go forward. The second thing, the theme that came out across all of those listening sessions was really about dignity-based services. And what folks want is to be involved in the design and implementation of services that make sense for them, that are person-centered and based in dignity, so that when they are receiving services or housing from our systems, that they don't feel further marginalized by those programs. The third theme that came out was really about the development of affordable housing and the need for additional affordable housing that we've heard about in the beginning of this presentation, and how we have to focus our affordable housing resources and target them to those who are most impacted by structural inequity. And Jill got to some of that in her presentation as well. And I'm gonna show you a couple of maps that I think are really interesting. And then the fourth one was really about removing police from our homelessness response system to the extent that we can, and to stop criminalizing homelessness. This is something I know that you all have been working on in Connecticut around criminalization in particular. So those are the themes that we heard from folks. I can't imagine most of you are surprised by those themes. And as we think about balancing out the needs of people who are currently experiencing homelessness and what it means to prevent eviction and prevent homelessness, we want to also make sure that we're targeting our resources. As part of the framework project, we worked with the Urban Institute to develop this tool. It's called the Emergency Rental Assistance Priority Index, or ERAP index, and I can put the link in the chat in just a moment. But one of the really interesting things that happened after we released this tool, I noticed on Twitter that folks were tweeting at Samantha Batko, who worked on this from the Urban Institute, and were saying that as they were looking at historically, the historic maps around redlining in their communities, and the highest need areas that were identified in this tool, they were largely the same. So I want to just note for a second what this tool takes a look at. It looks at housing instability as a risk index, COVID-19 impact as an index, and an equity as an index. So combining all of those things, the darkest colors here are the communities that are highest need based on those three sets of data. And here on this slide, you can see that on the left is Richmond, Virginia, on the right is Chicago and the Chicago area in Illinois. And you can see where we put the red circles, those were areas that were redlined historically. So I think it's incredibly important to keep this in mind. One of the things that I wrote down that Dr. Young said is that homelessness policy starts with housing policy. And what this map shows you is that that is absolutely correct. Historically disadvantaged communities subject to racist policies are still struggling. And we need to address these kinds of disparities in our work, because that carries over into homelessness. And here I took a shot at doing the same sort of comparison in Connecticut and Hartford. And you can see on the left is the Emergency Rental Assistance Priority Index, and you can see where the darkest areas or highest need areas are. And on the right is a map of places that were historically redlined. So the blue and green on the map on the right are places that were considered good investments for mortgages. But the red were the lowest grade investment, or risky, considered risky for mortgages. Those were the places that were specifically redlined. And the yellow were also considered somewhat risky. So you can see that there is quite a similarity, again, in your own community that really points to the need for making sure that we are using a racial justice and equity lens as we go forward in this work. So I want to take a moment to highlight what we've been calling in the framework work phase 4, which is really long-term change, and what that means. I know that a lot of folks aren't here yet, but we really want you all to be thinking about what opportunities for innovation there are within your community. And Connecticut is well known for playing well in this particular space. How can you leverage what you have to try and get at what Jill was talking about and address the disparities that Dr. Young was talking about, so that we have long-term change within our system. And I want to really ask you all to think about that innovation and change, and to lead the country in the way that Connecticut is known for in terms of these specific types of activities. The first is to institutionalize racial justice and equity practices within the homeless system. We can do that, we should be doing that, and Connecticut can be a leader in that area. We want to create real partnerships with people with lived expertise and listen to what they have to say to us and use that as a basis for making decisions as we go forward. We want to strengthen our partnerships with non-traditional groups. That could be neighborhood organizations that work with those historically marginalized populations. It could be other systems. But we know that we're not going to address all of the things that were laid out at the beginning of this plenary session without creating really strong partnerships with other parts of both our community and our government. We're going to create and implement dignity-based services as we've been asked to do by people who are in those historically marginalized communities. We want to reimagine shelter and outreach responses in ways that make sense for the communities that we serve, and target our prevention resources to those most close to homelessness with homeless dollars, and then do above that for folks who are at higher income levels with dollars that are coming hopefully down the pike through emergency rental assistance. And I'm going to talk about that as I close. And then we want to evaluate our outcomes and implement the kinds of corrections that we need as we learn and go forward. And what I want to end with is this. These are the things on this screen that we can control. As homeless service providers, as folks in this field, we can control most of this, and we should be doing these things as we go forward. But we also know that we don't have enough of the right things in order to be able to move forward in the way that we want and have and reach the goals that we want. We need a comprehensive housing package that includes resources sort of up and down the need spectrum, from shelter and outreach resources to rapid rehousing to permanent supportive housing and to vouchers. And if we don't get that comprehensive housing package, we know that some people, and that's usually people experiencing homelessness, are going to be left out of this of these solutions. So right now, I want to encourage everybody to vote because we need those changes to take place in order to address the needs that we've seen throughout this plenary presentation. And right now, Congress may or may not pass additional assistance before the election. So right now, the House has passed what we're sort of calling Heroes 2, and that includes $5 billion in homeless assistance grants to supplement the $4 billion we already have. It includes emergency rental assistance at $50 billion so that we can help low-income renters who are impacted by COVID and at risk of eviction to recover from the economic impact of coronavirus. It also includes things like project-based rental assistance, CDBG, additional CDBG dollars, and tenant-based rental assistance, specifically $1 billion for new one-time vouchers to help us move folks into permanent housing who are impacted by this pandemic. So I will end. I know we're probably maybe a minute over time. This is my contact information. I'd love to hear from you. And thank you again so much for having me today. And I'm gonna turn it back to the Commissioner and say, Commissioner, thank you so much for your service. What the decisions that Connecticut has been making are leading the nation, and I appreciate your time.
Thank you, Anne. And unfortunately, we didn't have enough time to have questions for our panel. Wow, what a powerful panel. Ladies, you guys have done a fantastic job. And it's just has given us so much information, so much things to think about. Thank you, Richard Cho and CCEH, for this great opportunity to get this information, analyze it, and to take action. To all of you, thank you for all your work. Right back at you, Richard.
Thank you so much, Commissioner. And again, I just want to echo my thanks to you, Dr. Young, and Dr. Khadduri, and Anne. Always a pleasure to have you with us, even if it's through video instead of in person. But thank you to you all. I know we're over time. I'm gonna close up really quickly just to share that for the rest of the day, up next, we have a great session on helping clients to overcome their health fears, knowing that it's sometimes that taking that leap to go undergo health screening is important. We've learned that especially over COVID. We have a great session this afternoon also on helping people who have pets to not think about pets as a barrier to housing, but actually address that. We'll be talking about some new initiatives that we'll be launching. And then finally, I do want to say, join the happy hour that we have at 4 to 5 p.m. I'm actually going to be hosting a trivia night for all of you. It'll be my first time doing that. So please do join that. Bring your own beverage, 4 to 5. Please come join us. And again, thank you all to our panelists and Commissioner as well. Plug this book one last time. It's a really important resource on how to end homelessness. So thank you all so much. Again, thank you to our panel. This was really fabulous.
Thank you.
Thank you. And with that, we'll close.